Hi, welcome to our channel. And today we're going to talk about whether or not you can reverse a cavity at home. So, in order to answer this question, we need to first know what a cavity actually is. So, a cavity is when the tooth has been damaged from bacterial acids, which then creates a hole or a defect in the tooth. Now, there are different stages of cavities, and if you'd like more info on that, go check out my other videos. But for today, we're just going to focus on how to get rid of cavities. Alright, so one way to start to potentially reverse a cavity is by treating the white spot lesion. White spot lesions are like the earliest stage of a cavity, where you have some demineralization of the tooth, but it hasn't gotten to the point where it's caused a hole in the tooth yet. Now, ideally, you want to catch this lesion early, because the earlier you catch it, the easier it will be to treat and the higher the likelihood that you will be able to reverse the cavity. Fluoride is like your ultimate sidekick when it comes to fighting cavities. It works wonders by helping to remineralize your teeth, and trust me, it's been shown time and time again to cut down on cavities. But please remember this, for those who are at risk of fluorosis or seeking natural products or as adjuncts to fluoride therapy, please check out our other video on which toothpaste is option for you. So, how do you get this superhero ingredient? The simplest way is to use fluoride toothpaste and use it twice a day, once in the morning and once at night. Alright? Now, the diet. So you can have all the fluoride in the world, but if you're not eating the right foods, it's probably not going to work. And really, the main thing that you need to do is to cut back on the refined carbohydrates, the simple sugar, the easy-to-eat carbohydrates, and the reason for this is that these are the types of foods that feed the bacteria in your mouth, which produce the acid that causes cavities. So it's really important to eat more whole, intact foods, less processed foods, and to avoid snacking throughout the day. Snacking throughout the day keeps the acid attacks going throughout the day. So you want to limit your carbohydrates to meal times only. If you do that, your mouth is going to have a better chance of remineralizing during the times when you not eating. Alright, so now that we've talked about what does work, let's talk about what doesn't work. First and foremost, if you've tried this at home, you might have heard of putting coconut oil on your teeth. And while coconut oil does have some antibacterial properties, no actual scientific data shows that it helps with cavities. Another thing that you might have heard of is using apple cider vinegar. While apple cider vinegar is acidic, it's not the right type of acid to help fight cavities. It could potentially make things worse. Another thing that you might have heard of is using hydrogen peroxide as a mouth rinse. Again, hydrogen peroxide does have some antibacterial properties, but no actual scientific data shows that it helps with cavities. And using it as a mouth rinse can dry out your mouth and possibly increase your risk of getting cavities. Also, another thing that you might have heard of is using oil pulling. Oil pulling is the practice of swishing around vegetable oil or sometimes coconut oil in your mouth for a period of time. Again, no actual scientific data shows that it helps with cavities. Alright? Next, when do you absolutely need to see a dentist? Well, if you have pain or swelling or redness, that means that there's inflammation. And when there's inflammation, that means that there's an active bacterial infection going on. And if you have an active bacterial infection, you need to be on antibiotics. And you can't get antibiotics without seeing a dentist. So that's the main reason. But also, if you have a cavity, especially if it's progressed past the white spot lesion stage, where now you have a hole or a defect in the tooth that needs to be filled. Otherwise, that cavity can continue to grow and eventually you'll need a root canal or you'll lose the tooth. Alright, so let's do a quick recap of everything we've talked about today. So first off, you can potentially reverse a cavity at home if it's in the early stage, like a white spot lesion. The absolute best thing that you can do is start using a fluoride toothpaste. Fluoride is amazing for helping remineralize the tooth. It's been proven to reduce cavities. So definitely get a prescription for a fluoride toothpaste and use it twice a day every single day. If you can't get a prescription strength one, then at least get an over-the-counter one. The next thing is diet. You can have all the fluoride in the world, but if you're not eating the right foods, it's probably not gonna work. So it's really important to eat more whole intact foods, less processed foods, and avoid snacking. Snacking is the worst thing you can do because it keeps those acid attacks going throughout the day. So you want to limit your carbs to meal times only. When you brush your teeth, make sure you're using a soft bristle toothbrush. You're being gentle and you're brushing for 2 minutes. Another thing that you can do is consider getting a remineralizing treatment done in the dental office. These treatments put more minerals into the mouth and can help remineralize the tooth. Alright, so now let's talk about what doesn't work. There's a lot of stuff out there online that people say, oh, this will get rid of your cavities, but there's really no science behind it. One is coconut oil. There's no science showing that it helps with cavities. Another thing is apple cider vinegar. Again, there's no science showing that it helps with cavities. Hydrogen peroxide, there is no science showing that it helps with cavities and it can actually dry out your mouth and possibly increase your risk of getting cavities. And lastly is oil pulling. Again, there's no science showing that it helps with cavities. And then finally, when do you need to see a dentist? Well, if you have pain or swelling or redness, that means there's probably inflammation. That means there's an active bacterial infection going on. Or if you have a cavity, especially if it's progressed past the white spot lesion stage, where you now have a hole or a defect in the tooth that needs to be filled. Otherwise, that cavity can continue to grow. And eventually, you'll either need a root canal or you'll lose the tooth. As always being said, the information is not intended to diagnose, treat, or prevent any disease. Always consult with your local dentist for personal oral health advice. Until next time, take care of yourself because you deserve it.